Good evening, everyone, and welcome to One Healthy Boston's Facebook Live. I'm Kristen Perfettio. According to the CDC, suicide is the second leading cause of death among teens in the United States. And that means that on an annual basis, more young lives are lost to suicide than heart disease, cancer, and chronic illness combined. That is a startling statistic, and that is why we are joined by Dr. Barbara Greene tonight, a psychologist for South Shore Health. Dr. Greene is going to walk us through some of the risk factors, some of the warning signs, red flags, if you will, for teen suicide, or in general, suicide regarding all ages, and that there's also help and hope, correct?
Absolutely.
We want to thank you so much for joining us tonight, Dr. Greene. This is a sensitive topic, I understand, but I think that we'll be able to get the message across that there are folks out there who can help you.
Yes, well, it's my pleasure to be here. It is a sensitive topic, but it is a conversation we must have. That actually the data more recently is indicating higher levels and increases in rates of suicide, both among teens as well as adults, and that's a concern. We don't yet understand in terms of what the data is showing us and the research why that's the case, but it is a conversation we must have. That when we think about suicide being the second leading cause of death and we compare it to heart disease or cancer, those are illnesses that cannot necessarily be prevented, although good lifestyles do a lot. But I hold hope around work that we can do to mediate and lower, again, the rate of suicide and behaviorally intervene with early identification, intervention, and then referral. That's really the task ahead of us.
And before we really get into a deeper discussion about how all of those things can come into play, let's just dispel a myth to begin with. Talking about suicide with your loved one or your teen does not necessarily encourage thoughts of suicide. Is that correct?
Absolutely. And I think that's an essential myth to dispel, that it's actually quite the opposite. That I say all the time, whenever I am given an opportunity, that talking about what you're feeling, having conversations or dialogue about mental health issues, asking, are you feeling unsafe or at risk, is actually exactly what we want people to do. It's what I will train any adult in my capacity to do, that lets a teen know that we're observing, we care, and there is help.
Okay. And again, it doesn't necessarily have to be a clinician, someone who can say, oh, this child or teenager is thinking of thoughts of suicide. It can be a friend, a parent, an aunt, a grandparent, those people in their lives, right?
Absolutely. That in particular with teens, their herd, their tribe, are their peers, their friends, and they're the ones who often know them best. That's not to say that we as adults who care about teens in our lives don't need to know them. I encourage that. I think it's fundamental. But teens really know each other. They know what they're experiencing. They know if someone's been cut from a team. They know if there's been a breakup. They know if there's been kind of a mean girl thing. Kids know what's going on with each other's lives. So the fact that we want kids to know, to ask, how are you feeling? I'm worried about you. I'm concerned. Is something going on? I've noticed something. That's what we want teens to do, along with every adult who cares about teens and is involved in their lives.
Okay, we're going to get to some of those warning signs and red flags in a few seconds,
Great.
but we have some great questions already. Frank says that nothing can stop suicide. Can we tell him that that's not true? I mean, that isn't true, right? Every one of us should do or is faced with someone in a crisis?
Well, I think that that's a complicated question, and I don't think that it necessarily has an absolute black or white answer. What we can do is intervene. We can care about people around us, whether it's a teen or an adult, and we can be present and help them get help. Ultimately, tragically, we have had some very high-profile suicides Anthony Bourdain. We know, and we know from the data actually, that suicides have increased. But that is not to say that we shouldn't be doubling down. What that data says to me is we must double down and do everything within our efforts, both with what I refer to as upstream prevention, as well as identification, intervention, and referral. And those are kind of two different categories, and we can talk about that a bit later. But our effort is to prevent suicide. And in fact, nationally, we have a program, an initiative underway called Zero Suicide. And it is encouraging, it's a systemic approach within communities, creating linkages to help people be identified, get within access to care, get into care, follow up, because the goal really is zero suicide. And it's a really important initiative nationally.
Okay. So let's talk about warning signs, red flags. What should people be looking for with their teens?
Well, so I'd like to break it down into a couple of different categories, but I want to start with kind of a sense of broadening the perspective from typical to troubled. We all have bad days. All teens have bad days. All teens might experience sadness, but transient sadness is very different than clinical depression, which places somebody at greater risk for tendencies towards suicidal ideation or suicidal behavior. So the warning signs really break down into what I consider three categories. And this is, I work with understanding things in systems approaches. So I want to look at them in three categories along a spectrum. But if you consider behavioral changes, emotional changes, or physical changes, we can begin to think about how do we get to know our teens so we're really knowing them. Because the goal is to know, are things changing? Are things different with this teen than they used to be? And then the caveat is severity, intensity, duration, and impact on function. So if you take those three categories of warning signs or risk factors and you break them down into intensity, severity, duration, and impact on function, we begin to get a composite picture of teens and who they are, both in terms of risk factors as well as warning signs.
Okay, that's a lot. Well, and I know every teen is different, but if you could paint a picture, if you will, or give an example of what maybe a parent may see in, I'm just looking for something a little more tangible that people can grasp.
In terms of warning signs.
Sure, exactly.
Absolutely. So if you look at, if we take the category of behavioral, are there changes in academic performance? Have grades dropped? Have they lost interest in their activities? Are they someone who really loved being on the dance team? Or were they involved with drama? Or were they, one of the star hockey players, per se? And have they diminished their interest and kind of lost that and dropping out of the activity? Do we see changes in terms of acting out? A teen who might have been not somebody who would be aggressive or acting out and suddenly are. Do we see an increase in terms of substance use? Behaviorally is something really that we need to look at and understand and be really keenly tuned into. Physically, do we see changes in appetite? Loss of appetite or significant weight gain that really feels unexplained? Do we see changes in sleep patterns, either challenging difficulty falling asleep, staying asleep, or seemingly being bitten by the sleep bug and sleeping constantly? Do physically, younger children, for example, will often be somatically responsive. They'll say, I have a bellyache. Teens will have a headache
Okay.
They'll show fatigue. They'll have lack of energy.
Okay.
That's kind of in the physical category.
Mm-hmm.
And in the emotional category, which I think is often what we kind of most look towards, do we see tremendous sadness,
Okay.
tearfulness, hopelessness, helplessness, along with, and this sounds difficult to discern sometimes, irritability, acting out, annoyance,
Okay.
anger, frustration. Now, and again, to understand this along a spectrum, teens get frustrated.
Sure.
We get
Yeah.
frustrated. 128 traffic in the rain at rush hour creates frustration.
Right.
But there's a difference between the transient experience of it and the severity, duration, impact on function.
Okay.
And if we think about, kids who kind of brush it off, maybe they get cut from a team or they've had a bad grade on a test, but there are these kids who, have this kind of resilience, internal resilience, and they get up and they brush it off and they get back at it, as opposed to teens who really begin to look like they are being defeated by life.
Okay.
And they're not getting back up and getting at it.
Okay. All great. That's all great information. Thank you. We've got a ton of questions that are coming into us. Right now, Roxanne asks about the interpersonal theory of suicide. What is it and do you use it?
It is not something that I personally have been using in our prevention work at the hospital.
Mm-hmm.
Interpersonal suicide, when anyone has been exposed to loss or suicide, they are at greater risk for suicidal ideation and behavior. But what we're talking about in my work at the hospital, which is very different than my work clinically, we work in prevention and education in the hospital, and working in communities geographically within our range, because regionally what we want to create is a reduction in stigma, an opening of the dialogue, and an understanding that resources are available, because the goal is to prevent suicide.
Okay, terrific. Karen wants to know, we've talked a little bit about the warning signs, but also says suicide runs in her family, and is that possible? Does suicide tend to run in families?
As I said a moment ago, anytime someone has been exposed to loss by suicide, whether it is a friend or within a family, we know that that predisposes them to greater risk.
Mm-hmm.
We know that for those who attempt or complete suicide, it is an act of despair and desperation. And if it is accompanied, if it is being promoted by severe depression or mental illness, there are genetic linkages that we can map through families. When I work with a family clinically, for example, I'll do a family history and ask, is there a history of depression, bipolar depression, suicide, or substance use, anxiety within the family? Because we know that there are both predisposing biological factors as well as cultural factors that can then come into play through the lineage and the history of a family and a family tree.
Okay, thank you for answering that. Jeremy asks, how can the state help me? He says he's finding very few services for men.
Well, Jeremy, I'm glad you're responding and tuned in tonight. What that says to me is that you want some help. And I want to first turn your attention to the National Suicide Prevention Lifeline number that is posted. It is both chat as well as online, and it's available 24/7. We do know that resources can be challenging, but the good news is for us here in Massachusetts, we're working very hard. We actually have been one of the leaders in the country for suicide prevention with a coalition that has been working regionally for many years now. I would encourage you, if you have a primary care physician, to reach out to your primary care physicians. One of the things that physicians do today is screenings and at annual appointments. And many primary care practices today have embedded mental health clinicians available to provide resource and treatment directly within the medical office. Additionally, we have community-based resources that I would encourage you reaching out to, the VA for veterans and others within the community mental health system. Part of what we're doing at South Shore Health is we have recently created a merger with Aspire, previously known as South Shore Community Mental Health. And our initiative, the goal is to integrate primary care, medical care, and behavioral health care all as one. And Aspire on the South Shore provides those resources that may not be available through a private clinician's office. So I would encourage you to look for something similar within your own community, or if not, call Aspire. We can help you with that number, and they may be able to assist you directly where you live.
Thank you. Valuable information. Nancy says that she is still beating herself up about her brother's suicide, and she asks what could have been done.
Nancy, first let me say that I'm sorry for your loss of your brother, and that loss from suicide is a very different loss. I myself experienced loss of a boyfriend, a high school boyfriend, when I was a young adult to suicide. So I have empathy for what you continue to navigate emotionally. Clearly, you're in pain, and grief from suicide is unique, as I said a moment ago. I would encourage you to get some help with it. Beating yourself up from the loss of a brother who you loved, while it may be something that you're doing long term, it's not going to help you push through, navigate, and move through loss of your brother. You know, we can do all we can to be aware of the risks, the warning signs, and to intervene. But tragically, we're not 100% foolproof. So the American Foundation for Suicide Prevention is another really wonderful resource that is helpful with respect to understanding the idiosyncrasies of loss due to suicide. So I would direct you also to that as a resource. So I'm sorry for your loss, Nancy.
Lorna has wrote in to say that suicide has no age limit, which we have learned this evening for sure. She wants to know why we're talking about teens. Is it expertise, back to school at this time of year? Do you work with adults and adolescents, or is your expertise mostly towards adolescents and teens? I think she's just looking for some clarification.
Well, certainly. And yes, you're right, Lorna, that suicide is not just a teen concern or a concern that we have in terms of a public health issue with teens. But in fact, actually, some of the data is showing us that middle-aged men and elders are at least greater risk for suicidal ideation and behavior. I think we're focusing on teens today. Part of my role at South Shore Health is as medical director of Youth Health Connection, and we're a risk prevention and suicide project starting our 26th year at South Shore Health. So I believe that that's why initially the focus was about teens. So my work with prevention is really around youth and communities, but my work clinically is really with people across the lifespan.
Let's talk a little bit about the protective factors that people can instill perhaps in adolescents and teens as well, or in anyone really. And that would be, skills in problem solving, right? Or conflict resolution and strong connection with family and friends. What are some things that we can do to help protect our teens and adolescents, our children, or even our older loved ones?
That's a great question, and I'm all about protective factors and building in resiliency. In fact, one of the missions, one of the goals with Youth Health Connection is to increase resiliency in teens and communities and families, and therefore reduce risk. Because we know if we're increasing resiliency, we are in fact reducing risk. And we know that one of the greatest anti-risk factors for teens is connection to a trusted adult. And whether that's a parent, a mother or father, whether that's to a teacher, a coach, a nurse, an aunt, an uncle, connection to a trusted, caring, loving, knowing adult is the greatest anti-risk factor. I also think it's really important, and in Massachusetts we're quite fortunate that social emotional learning is part of most curriculums in school districts today. And those curriculums for social emotional learning are really K to 12.
Okay.
So they start young and they build in language, emotional language. We teach kids, what am I feeling? What is making me feel this way? What do we do about it? We work with teaching problem solving. We work with teaching them capacities for meditation, mindfulness, yoga, mantra work, which is really around stress management. We're working very hard to help educate around social media. That is not something that has arisen in our conversation or dialogue to this point, but it's something that I think we must address, because the data around social media and the research that's being done today is really leading us to understand the risk factors for teens who are exposed to tremendous amounts of social media, and the way in which particularly teens who are anxious, prone to anxiety or depression experience even greater risk as a result of that use of social media. So really teaching them what happens with it, and teaching them regulatory skills, both emotionally, behaviorally, socially, and physically, is part of what we're trying to do. We also, through Youth Health Connection, have a program called South Shore Facts, which is family, adolescents, communities together against substances. Because we know that there can be early substance use can really lead to increased levels of anxiety and depression, and therefore greater risk for suicidal ideation and action. And that substance use is never good for the developing teen brain. So we're working very hard to have communities build coalitions, to educate parents, to know again that parental disapproval is the greatest number one risk factor, anti-risk factor for parents with teens against substance use. So that's another very important point that we are working on, where we want to protect their brains, we want to keep them safe so that they move into young adulthood when their frontal lobe is coming back online after reconstruction, and they have capacity to control impulses, have better decision making, understand their emotions in ways that is more challenging when the frontal lobe is under development.
Yeah, fascinating. That really is. Roxanne is suggesting that Mass Health has a social work team that can be sent to a patient's home. Are there other resources like that, and how do we find them?
Yes, actually, we do have emergency services here within communities, accessed within the community mental health system that can be sent to homes. We have it through South Shore Health now an agreement with our ambulance service, and they've been trained to understand mental health issues and intervene at the home level. The in-home therapy and emergency response teams that can go directly to homes are critical and can be ultimate lifesavers for sure.
Roxanne also added, there's a great quote, or she has a great quote, it is okay to feel this way, but it is not okay to feel this way alone. Make that call.
Thank you, Roxanne. Well said, and very important that we know that connection is vital. Everyone may at some point in time feel sad, as I said earlier, but sadness is different than profound depression. But reducing isolation, increasing connection, making sure that people know that they're cared about and cared for can really help mediate the risks.
Wonderful. Nancy suggests that someone who reaches out needs to get help within 24 hours. Any comment or your thoughts on that?
Well, I certainly think that it's critical timing to intervene as soon as someone has reached out. Emergency rooms and hospitals are not necessarily the most optimal setting for intervention, but they are there 24 hours a day, 7 days a week, 365 days a year, always open at every hospital. And they are prepared to be able to act on behalf of safety and reducing risk for someone who may, in fact, have reached out. So that may not be the long-term solution, but in the immediacy of crisis, that is where people should go.
We talked about protective factors, which was, again, strong connections to family and friends, a trusted adult. But are there preventative measures that adults can do as well with their teens, in fact, to teach them that they're not powerless? And I guess what I'm trying to get at is, encouraging them to get involved in school sports and activities at school or clubs or groups, monitoring their social media, again, those types of things. So really preventative measures or preventative advice for their children or teens to get involved and to talk.
Well, I think parents are very powerful influencers in teens' lives. I often, in my office clinically, will have parents say, well, they don't listen to me. And I come back with, yes, they do. They actually really do listen. And they're also watching. So I think it's important for parents to know that we are role models. How do we handle sadness? How do we handle our own stress? Do we talk about it? Do we narrate? This is how I'm feeling and this is what I do. Do we meditate at night rather than reaching for a cocktail? Do we include what I call and love the fun factor in our lives? Do we have a lifestyle around wellness that includes good sleep habits, healthy nutrition, connection to nature, important positive relationships that support and help us through difficult times? And being verbal about it, not just leaving it to chance, not just assuming that our kids will get it, but really talking about it, role modeling it, and living it are really important.
Oh, I love that. I love that. Janet wants to know, in regards to school emotional education programs, where is some of this work being done? Which districts are you aware of that were rolling out this type of stuff?
My exposure is primarily on the South Shore, and I can tell you that essentially every district in the South Shore within our South Shore Health System catchment and within the Youth Health Connection community are all working on social emotional learning. That doesn't mean that it's a one-size-fits-all or cookie-cutter approach. Just as districts will select individual reading programs or math programs, districts should, in fact, do a needs assessment and really match what arises from that needs assessment to their strategic plan and then implement at the school level what fits with the needs that arose through the assessment and what fits with their strategic plan and what they can, in fact, implement in their school.
Okay. This is a big question. How do you talk to your child about suicide, to your teen?
Well, I mean, that's a difficult question for sure, but I think that we need to talk with them carefully. We need to be age appropriate how we talk to them. That how you would talk to a 5-year-old is very different than how you would talk to a 15-year-old. Okay. But I think we start by understanding, and I'm a huge proponent, that we need to reduce the stigma by increasing the conversation and opening the dialogue. And that we start with people feel sad sometimes, but there's a difference between feeling sad and being depressed. But that suicide is not a solution to a problem that can be mediated. And that for districts, and you know, tragically we've had suicide losses here in Massachusetts, as well as at the national platform. Kate Spade's suicide has really opened up the dialogue. So we have kids saying, well, why? Why did she take her life? And I think we need to say we may not know the specific answer, but we know there are things that can help people feel better and live better.
Words that are just wonderful. Thank you so much for sharing that with us. If there's anything that we can leave our audience with tonight, what is that key takeaway that you want them to know?
Never give up in terms of reaching out. Always hold hope that there are wise minds working hard, doing research, moving us forward in understanding what we need to do with upstream prevention, as well as how we can intervene with evidence-based treatment that can really save someone's life. There is help. Do not fail to reach out.
Thank you for all the work that you do.
Well,
thank you so much.
It's a privilege. Truly a privilege.
Well, it's been a privilege sitting here with you tonight and learning all of this. Thank you so much. We do want to remind folks at home the National Suicide Prevention Lifeline to call 1-800-273-8255 if you feel that you need to speak with someone about your current situation. And I do want to thank all of our viewers at home who wrote in with questions or your personal stories tonight. We have heard you. I'm sorry we can't get to everyone, but we do appreciate you joining in on the conversation. Please pay attention to that suicide line and visit onehealthyboston.com for more information that you may need in regards to this topic. Thank you again, Dr. Greene, for joining us. We want to thank our viewers. Anyone who missed tonight's segment can view it on onehealthyboston.com. We'll see you again next month, and thank you to everyone.
Thank you.